The use of nitrous oxide is making a return to help women during labor with pain management. Dr. Stephanie Cropper, an obstetrician and gynecologist at Pomona Valley Hospital Medical Center, reveals how this method works and the benefits to both the mother and her baby.
Nitrous oxide has been used since the 1800s for labor pain. It was used in the United States in the 1930s and sort of fell out of favor in the 50s, but has been used throughout Europe and Australia as a major source of pain relief for labor patients. Over 50% of their patients use it. And it started to gain favor again here in the United States. It's being used in about 450 different locations, including UCSF. And we are going to bring that to Pomona Valley. We're very excited about it.
Dr. Cropper lists some of the benefits of the use of nitrous oxide during labor.
It's nice because it's self-administered by the patient. It's very inexpensive. It does not require any invasive procedures like an epidural. So just knowing that that is another source that's available to them that might relieve their pain and anxiety during the delivery is a great option.
Dr. Cropper outlines how the patient uses nitrous oxide.
It's through a gas, and they will hold a mask up to their face. We have them not attach it so that it's completely self-controlled. And you can use it not just for the contraction pain, but even if you're planning an epidural, you could use this until you're ready for your epidural. You can still walk while you're using this. You're not, numb like you are from an epidural. So it helps with not only the pain relief, it's going to decrease your perception of the pain, and it's also going to help with anxiety as well. It has sort of a calming effect. And you can use it if you inhale 30 seconds before you're expecting your next contraction. You're going to have the peak of the nitrous during the peak of your contraction. And the patient can use it as much or as little as she wants. You can even use this after the birth for things that might happen afterwards, such as if you need to have a laceration repaired or something like that.
Nitrous oxide is a pain management tool which has been proven safe.
This isn't going to have any effects on the fetus, so we don't need to do any special monitoring. It doesn't impair the APGAR scores after birth or anything like that. So a lot of times, if someone's moving very quickly, say they've planned an epidural, but they come in and they're 8 centimeters and anesthesia doesn't want to sit her up for an epidural because the baby's about to deliver. We don't really want to give IV pain medication that close to birth either, because then when the baby comes out, it can be sedated, you have low APGARs. But the nitrous would be, a measure that could just get you through those few minutes that you need to get through childbirth. So it's an extra option. And then epidural has become very, very popular, but then you also, you can't walk once you get your epidural. You're sort of stuck in the bed at that point. So even if you could use the nitrous, maybe you're planning an epidural, but you could use the nitrous to get you further along in labor so that you're not stuck in bed for as long. Or if say you're having an induction and it might be a prolonged labor, you don't really want to have an epidural in place for 24 hours. For prolonged amounts of time. So this might be able to buy someone who's having, a little more pain than they want, but they don't quite need an epidural yet, or maybe they're just really anxious about the labor process, and this will just have a nice calming effect for them.